Hello, this is David Harrington, President of Center for Neuro Skills.
And this is Chris Persel. I'm the Regional Director of Clinical Services and the Director of Behavior Programming at the Center for Neuro Skills.
And this is the Center for Neuro Skills podcast. And for this podcast, we're working with the American Heart Association. Why, Chris? Because heart health is brain health.
That's right, David. A lot of people don't realize that, but there's a very strong connection, and you really can't separate the two.
You know, Chris, you and I worked together for a long time, and we've talked about this in terms of the differentiation between CNS. You know, at our core, we view it, people as a whole person rather than fragmented care. I worked in other levels of care, from orthopedics to the hospital to here at Center for Neuro Skills, and I'm truly proud of what we do here. And when I say the whole person, I'm not talking about just the fine motor coordination, gross motor coordination, vision. You know, I'm talking about a person resuming his or her role as father, mother, grandfather, dentist, nail person, whatever it may be. But we also look at, you know, other systems, because the brain controls everything. And when we say heart health is brain health, we mean it, because heart disease puts people at risk of having strokes. So there's a direct connection between heart disease and the people we treat who have strokes. But we're also looking at brain recovery and the impact on sleep and that circadian rhythm, how we consolidate deep in REM sleep to figure out declarative and procedural memory. We're looking at self-worth, adjustment to disability. And so when we say we're getting to the heart of brain health, we really, truly mean it.
Exactly right, David. And I know that in the last 40 plus years that I've been working in this field, it's really ignited not only the passion. Just about every single day I show up, it's seeing the recovery. I'm inspired by our patients and those folks that have experienced a stroke, traumatic brain injury. It is an uphill battle, and every day they're coming in and they're working hard. Our staff are working hard with them, and ultimately everyone benefits from that. You know, we get a lot of benefit just seeing that human spirit that our patients are able to demonstrate each and every day through their struggles and their recovery, and there's, you know, that continues to fuel that fire for me.
Chris, you mentioned you've been here for 40 years. I've been here for close to 30 years. We're about 70 years together, you know, between the two of us. And it's just amazing to see how the industry's changed and how we grew from somewhat of an infancy from an organization, but as an industry to where we are, and knowing the neuroscience, and CNS has definitely grown in our footprint and our sophistication. It's really impactful in terms of the longevity and the years of experience here at Center for Neuro Skills, especially between you and me.
Yeah, wow. You know, 70 years between us. Yeah, 40 plus, 30 plus. I wondered who that old guy was looking at me, you know, in the mirror every morning when I get up. But it's been really a passion. And, you know, with my background in behavior analysis as a certified case manager, and being instrumental in developing an independent living scale that we are able to assess our patients and their performance on day-to-day activities, it's just really been kind of full circle in being able to see and experience all of this. And, you know, we do a lot of research. We're really looking at the important components that can help our patients recover even faster and even more than we've seen over the last 40 plus years. We've also, you know, you and I have written things out there trying to get this information out there, because a lot of people are not aware. They don't, you know, you don't really pay attention to it until you have to. And while that's okay, it means that folks continually need to be educated, and we take a very strong stance in trying to get information out there through presentations. You do a number of those, I have over the years, and it's really focusing in on folks that have sustained these neurological injuries through stroke and brain injury and other health conditions that may have brought them to our table, and it's our job to really help them recover at that point.
Yeah, Kristen, you touched upon something that's truly meaningful to me, and really what's kept me in the neuro space, because I have not always worked in the neuro space, but that's where I've worked for the longest time. I'm driven by the social impact. You know, the fact that we can stand by others and help them to reclaim their independence, their life roles, And it's that impact that keeps me coming back every single day. And our staff, quite frankly, who have that major impact. And it doesn't matter whether you're clinical, residential, in accounting, in sales, it's this entire ecosystem of healing and recovery that's so important. I have a clinical background. As you know, I'm an occupational therapist, but I kind of came up through the ranks as a direct care staff. I was an architect major when I went into college, and it's Center for Neuro Skills that really changed my mind and my direction in my career, because I just felt that the impact that I could have on people's lives. And for me, it is there's no greater reward than standing by others as they reclaim their independence. And while I've tried out other aspects of healthcare, this is really where my heart is. I studied business, and I love the marriage between business and clinical. And really, my passion is the business of healthcare and being able to do what I can do from a system perspective to impact people's lives, help them reclaim their independence, impact their families. And quite frankly, we see in our clinics that a rehabilitation process, it gives their people their lives back.
Yeah, as an architect, you're building lives, right? There you
Nice.
go. So you kind of weave that into it, certainly. And I completely agree. We see people at their most difficult moments, these traumas that have occurred, and these folks then get thrust. And I always say, they're thrown immediately into this other world of healthcare, the emergency room, the ICU, the hospital setting, something that most of us really are not wanting to be a part of, but they're immediately thrown into this, being dependent upon all these other healthcare professionals to help them recover. And, that's a very vulnerable position for our patients to be in. And there's a lot of, fear of what's going to happen, what's my future going to be like, whether you're in law enforcement, you're a field worker, you're an attorney, you're an engineer, you're a coach. We see people across this entire spectrum of life, and they're out there living their life, and then suddenly they're thrown into this, and it does change their lives dramatically, and their abilities to eat and get dressed and have a conversation with their kids, or even hold their children. Those things can be affected, and it's very difficult for them in many, many ways.
Chris, what comes to my mind is really how we are different than other places where I've worked. And one of our mottos is patients don't plateau. You had mentioned the family and the disruption that they're going through, and that their lives have been catastrophically changed because of a stroke or traumatic brain injury. They come to us with a lot of fear and anxiety. And quite frankly, they're not in the best position in their lives. And for us to be able to have a net promoter score that's world-class, satisfaction that's over 90%, tells us that even in the darkest time of their life, that we can be the beacon of light and we can shine that path to them. And part of that is our culture. You can have PT, you can have OT. You can't necessarily have our clinical pathways. You can't have our research, but you certainly can't have our culture and our values. And I think the culture and our values is a true differentiator, because we say patients don't plateau, programs do. We know that if we apply an environmental stress on the brain, on that person, then the brain will rewire. The brain is plastic, and there's that plasticity is going to occur whether you guide it or not. And what we don't want is maladaptive plasticity. So that patients don't plateau, it just indicates that we don't settle for our patients at their current state. It's in our DNA. Everything from the neuroscience, we led this space in many ways because we were treating brain injuries before the neuroscience said that we could, right? We made a difference, and we had to have the data to prove that we were effective. We contributed to the literature to prove what we were doing was effective. And again, the brain will respond when it's put under the right kind of stress. And so we systematically turn those stones, every stone over, to see what's underneath it, to see what we truly have to address. And it goes back to, we don't believe patients plateau because the brain is plastic and continue to learn. And if we find a struggle there, we look at our program to see what we need to do different to get that person's life back to them.
Yeah, definitely. And through that process, it really is a partnership. It's a collaboration with so many people. And at the heart of that collaboration, at the center of it all, is that individual who's suffered these injuries or this traumatic event or stroke. And we really have to partner up them. We're looking at everything, like you said, no stone unturned. medically, behaviorally, emotionally, physically, cognitively, all of those aspects we are investigating. We are doing everything we possibly can to remediate it. I kind of have a little note up on my desk that says that, I feel like my job is to help to eliminate the disabling effects of these neurological injuries. It doesn't mean the injury is going to go away. We know that many times these things have happened, but our goal is to eliminate the impact that it has. And I have another quote that it says, we need to move these patients from that sick role. As I mentioned, they're thrown immediately into this role of being sick, into a learning role as quickly as possible. So we have to take that A student, we have to take that person who wants to get back to golfing or playing pickleball or, getting out there. We had a gal who was just a brilliant artist, and she was struggling because of the effects of the stroke. And, she wanted to get back to being able to do that. One of her paintings that she did post-injury is hanging up in our hallway now. It's a beautiful painting, and we see those kinds of things, getting people back into those lives, and we're treating that whole person, right? We're not just looking at one aspect, and we're not siloed into this one portion of what it is the recovery is. We need to look at this entire person and get them engaged, get them active, get them back to life. We talk about, community reintegration is at the heart of what we do as well. I like to use the term, it's life reintegration, right? We want to get them back to life and partnering up like they were before these events occurred.
That's right. Chris, as an occupational therapist, you're speaking my language, brother.
That's at the heart of me, yes.
It is, and you are an honorary OT. We've talked about in the past. And truly, what I find fascinating about the work that we do is that, as you touched upon, there are no two people who are the same, no two cases that are the same. And while we've developed clinical protocols over the past year on how to remediate fine motor coordination or visual motor response speed, the application of those activities to real life really does need to be individualized, doesn't it? So it's that individualized care that's so important. And this is where we say it's the heterogeneity of brain injury that's so important. And that's a fancy word to say you and I are different. Our bodies are different. The mechanisms of injury are different. Our motivations are different. So you think of traumatic brain injury versus stroke, different. There's also many different types of stroke. A brainstem stroke is different than an anterior cerebral artery stroke. So the type of injuries, the location, whether it was a hemorrhage or a clot, which, we can talk about in a few minutes if you like. Age, the comorbidities, if you have diabetes, high blood pressure, your diet's not good. Your understanding of these health factors. What is your mental health? Are you depressed? Is there a mood disorder, personality disorder? The various support factors. What we found in our time here, Chris, is that family is so important. And if you look at patients who do incredibly well and those who struggle a little bit more, that family is so critical. And that's why we envelop families into the process. And so it does require a comprehensive team looking to examine and treat comprehensively. And it's that individualized treatment that really does make a difference.
Yeah, I think that's always important. And as each person comes to the table with what their life has given them up to that point, and that autonomy, that independence, that ability to make choices is so important. And kind of bringing it back to the issues related to stroke in particular, we understand that, I think you've mentioned it many times. Heart health is brain health, and that may confuse some folks. It's like, well, what do you mean? Because I know many people, and my family has a history of cardiac related issues. That's why I try and do my best to abate those as I live my life. But as a result, you think everyone's focused on the heart, but over a quarter, 25% or more of all the blood that's circulating is going to I know I have a large head, but it's probably still not 1/4 of my entire being, right. But 1/4 of my entire blood supply is going to my brain. And then as a result, the oxygen, getting good oxygen flow to the brain is so important because the brain is very sensitive. So now it starts making sense, right? My heart needs to pump the blood that's got the oxygen in it. that oxygen is going to supply my brain. That brain is going to function better. That's the fuel. That's the what the brain needs to keep functioning properly. And if we're not able to do that, then that's when problems occur. And we know in strokes, that with the blockages or the bleeding that may occur, that's going to impair that blood from getting where it needs to and carrying what it needs to all the right places.
Yeah, Chris, a couple of thoughts that come to my mind given those statements is, of course, stroke is one of the main things we treat here at CNS, along with traumatic brain injury. Strokes are a big part of what we do. And it's so easy to maybe oversimplify a stroke, because you see a little dot or a little bleed on an MRI, but really what's happening is that beautiful ecosystem within our brain. It's not just the neurons, the things that carry the electricity, and they have the synapses and then all the neurotransmitters, but it's also the astrocytes, these vessels that, or these cells that take the blood from the vessels and provide nourishment for the neurons. And then you have oligodendrocytes, and those provide all the scaffolding for the astrocytes and the neurons. And there's so much more in this ecosystem that when you have some type of aneurysm or a clot, cell death, you're not just destroying just a little spot on an MRI. You're impacting this ecosystem, and really that's what we do here at CNS is we rebuild that ecosystem from the neurons to astrocytes to oligodendrocytes, and so it's really important to understand the biophysiological implications of what has happened because of the stroke, and really what needs to happen to repair the stroke. It takes specialized care from the right people at the right time. With the right treatments in order for this to happen. So, and I always say, connection is required for function. And if you lose that connection, you'll lose the function. And we also say that neurons that fire together, they wire together. And it goes back to that environmental stress that we need to put on a person with their activities of daily living, various activities. That's what rebuilds these neurons, astrocytes, oligodendrocytes, and gets the brain to rewire the way that it should so that a person can resume those big things such as their role as father and mother.
Yeah, no, I think that's awesome. And just taking your scaffolding analogy, imagine scaffolding going up the side and, you're trying to even just wash the windows on the, second floor. What if you didn't have a couple of legs or a couple of those structures that are supporting that scaffolding? You, one, are not going to be safe. You're not going to function as well. And you may crash and burn, as we say. And, so I think that's what those connections you're speaking about, they are the structures that are the building blocks for how we're able to function on a day-to-day basis. And if you look at stroke in general, it's the 5th leading cause of death in the United States. And obviously it causes many other folks just significant disabilities. So we're saying about 800,000 people, nearly 1 million folks every year suffering stroke. And I would say in my 40 years, unfortunately, that's much more frequent. It feels to me anyway. And there, every 3.5 minutes, you're going to have somebody who doesn't live through that stroke, and many more who do. And that's what we say that frequently is that it's the folks that are recovering. We have great emergency care. We have great ICU. A lot of these ambulances, they're like an ER on wheels, right? So they're able to help an individual immediately. And we know that timing is very important, and that, after just a few minutes without oxygen, your brain is going to begin to suffer some really significant issues. And I did even have an opportunity years ago to work with in a lab, a cadaver lab, where we were able to examine the brain itself. And it was one of the most amazing experiences I've ever had. And it was an individual who had suffered a stroke. And just to see the significant impact that lack of oxygen to a portion of the brain, just the way the tissue is unable to survive through that. So the individual survives the event, but those cells you spoke about, those connections you spoke about, have been interrupted and or damaged at a point where the individual needs assistance in recovering and a way to get better.
Yeah, and Chris, sometimes if you don't live in this neurospace, it can be really confusing. And even if you have a stroke, whether it's a bleed or a clot, When neurons die, they also enter this phase called apoptosis, where it's pre-programmed cellular death. So it's not even just even around that area, but it begins to cascade out. So the cellular death is actually greater than that original spot. And when you're talking about the cadaver and visually seeing that clot in the brain tissue and how that's just it just brings it more to life than an MRI. It goes to show you how significant this can be. And for the folks who are listening to this, there are several different kinds of strokes, but the two main categories would be hemorrhagic and ischemic. So hemorrhagic is like a hemorrhage. So it's right there in the name, right? That's why I love anatomy and I love medicine, because sometimes the word just describes it. And this is where a blood vessel weakens and you get this burst. And so the problem there with the hemorrhagic strokes is that you not only get this bleed out, which begins to put pressure on the brain. So you get this mechanical pressure on it that's stretching all those oligodendrocytes, astrocytes, neurons that can cause damage. But even that blood that's introduced to that ecosystem is toxic. And that's why we have structures like the astrocytes that can help to take the information or the nutrients from the blood vessels and funnel them over to this ecosystem, because we can't expose those structures to blood. But about 90% of strokes are actually called ischemic strokes. And this is where you have a clot. And I touched upon it earlier. Heart disease can cause clots to form. And those clots, again, then circulate and can end up in the brain. And it begins to, almost like a dam, block the blood vessel from carrying those essential nutrients and everything that our brain needs, oxygen, to those critical areas. And without that information or with those structures, we get cellular death. And so in both of those examples, whether it's hemorrhagic with a bleed or ischemic with a clot, you get brain cell death because our brains need oxygen.
Yeah, I mean, that sounds so intense, right?
Yeah.
Bleeding, blockage, and that's why it's so critical to get help quickly, right? That sudden onset, and there are acronyms out there that folks can be familiar with, whether it's FAST or BFAST, meaning if you're experiencing balance loss, vision problems, facial droop, arm weakness, difficulty with speech, then time is of the essence, right? And there are ways that they can address the blockages through some, medications that are applied. And if it's a hemorrhagic stroke, there are things they can do, get you into a surgery or something that can really help alleviate, because we know on the post-acute end, in the rehabilitation side, the more that critical care is delivered as immediately as possible, as efficiently and effectively at a high quality as possible, those individuals have the greatest opportunity to really recover to the best of their ability, because that timing is so important. So I think it's really important that people continue. Like I said, if there's been this rise in numbers, maybe we aren't paying enough attention. So people really need to pay attention to what you've said, as well as just recognizing the symptoms in themselves and their loved ones.
Yeah, Chris, this is where the marriage between the Heart Association and CNS, I think, is so important on the prevention side and the post-prevention side, we can call it. Because even in my family, you talked about heart disease in your family. It runs in my family too. And I just had my yearly physical. This is a concern for me every single year, because I just know that there's an issue in my family. And so it's something that's on my mind. And so that prevention is absolutely critical. I had a family member a couple of years ago we're talking about him, where he had heart disease and he threw a clot. And at that time, he was unbalanced. He couldn't walk very well. He was trying to look at things he just couldn't see very well. He had just a slight facial drooping, not significant, but slight. And he was complaining about arm weakness. And he ended up in that moment a little worried. And he was basically seeing ants crawl across his dashboard. And he called my dad, probably not the right person to call. Could have been 911. That would have been better. Because you said time is of the essence and every single minute counts. And so this is where prevention is so absolutely critical. It's something that I think about But also when prevention is no longer an option, then what do we really need to think about? And what you do in that moment between going from prevention to post prevention can save your life. It can actually reduce the amount of disability. And we talk about that neurological ecosystem. It means that you're going to do less damage if you call. And Chris, I'm telling you, even in my own family, we don't know this well enough. And the more we can get out, the prevention, the be fast or the fast, I think is really a critical message for all of us to deliver.
Yeah, no, it definitely is. And there's even some other things that people need to pay attention to that I reflect on myself. And that's these transient ischemic attacks, TIAs. So these are like temporary losses of blood flow that cut off to your brain, where you might experience some of the same symptoms you were just mentioning, but they may have gone away. So take your uncle, for example. If within a few seconds or so that they kind of went away, he might not have even called your father. He might have just, kept driving down the road and missed an opportunity to really catch something. And people will ignore those small things. Oh, well, it went away. It's not a big deal. Or maybe it was my blood sugar, or maybe it was, which probably needs attention if it was, but there may be something else that was going on. I didn't sleep well last night, whatever it might be. But the problem is those TIAs increase risk of one of these other strokes that you spoke about earlier happening. So we really have to pay attention to our brain, to our bodies, to what we're seeing and doing in the world. And if something isn't right, make sure you get professional assistance. And not that your dad didn't do a bad job. He probably said, get some help, dude.
That's about what he said. He got him there. So I do appreciate my dad getting involved, but EMS would have been much better. That's for sure. Yeah. And so that timing is important. And all this sounds really scary, but there is really a lot of good things that can come from us with knowledge, is that we can minimize our risk of stroke. To take the examples that we've talked about and apply it to our own lives. Chris, you had talked about earlier how you're very intentional about remaining healthy. I know you do yoga every day and meditation. You're very active. I've known this about you for a long time, and yet another area where you've mentored me very well. So that stroke prevention is really important. And again, going back to heart health is truly brain health. We mean it at our core. We treat the post-acute or the post-injury side, but there's a lot of people we can treat, and it's in our mission, vision, and values to advocate for health, to advocate for people, and prevention is part of our job as healthcare providers. It's definitely part of our message at Center for Neuro Skills. And Chris, I just want to really underscore something you said earlier too. I think it's really important. Each time the heart pumps, 20 to 25% of the blood goes to the brain. So it's a massive consumer of the blood, of the oxygen. It just shows you how much our bodies really, the resources that our brains require. So just even a short period of time without oxygen, without those nutrients, it can have a devastating effect.
Yeah, we have to keep ourselves healthy, right? Because stroke and heart attack, there's definitely a similarity there, because that means the blood flow is going to be interrupted. So taking care of your health, taking care of your heart, taking care of your brain, because, brain health is heart health, right?
Yeah, that's right.
Or heart health is brain health. I don't know which way it goes. Either way, the blood circulates through both.
Absolutely. What you said is accurate both ways. Absolutely. So, and one thing, people think that blood pressure is a big deal, and it's really the big one. Again, at my yearly physical, not to make my health part of this podcast. That's not the intent. But I do have to celebrate, because my blood pressure is great, but it's something that at one point in my life wasn't. And it really did take a lot of intention and a lot of work to make sure that my blood pressure is where it needs to be. And it's with this education that's made a big impact on me and my physician. I feel like he should have given me some type of ribbon or some type of star because it was well with it.
I would say, we'll give you a high five.
There you go. Yeah, there you go. As a behavior analyst, you know how to reinforce that behavior for sure. But it's not only just the blood pressure. It is a major factor, but there are also other risk factors such as diabetes, smoking, a lot of behavioral issues that play into the risk of having a stroke, things that can be prevented. And of course, the younger you are, when you get a hold of this information and you use it, the better. So diabetes and smoking can definitely damage the blood vessels, raise your blood pressure. You need to, as you said, Chris, eat healthy, exercise, avoid alcohol, tobacco, and all of this to really reduce your chance of a stroke. And so it's important to point out that it's a myth that all strokes are caused by high blood pressure, diabetes, and tobacco use, because there are other factors such as high levels of estrogen. There's also high cholesterol that can increase the risk of a stroke. So heart health is truly brain health.
Yeah, and I think it's amazing to me, and I'm a data wonk. Is that what it's called?
Yes,
a data nerd. I don't know. Yeah. Love the outcome information and looking into the weeds. And one that's always amazed me is I think it's this kind of younger and younger average age of our stroke patients. You know, when you think of stroke and you think of heart attack, those kinds of conditions, you think of an older population. And I resemble that. But, and I always, when I wake up in the morning, I think, hey, I've reached this age and haven't had anything at this point, knock on wood, anything traumatic occur or, stroke, heart attack. But many younger people do. We've treated college students, young professionals in their 20s, and parents that have, small 2-year-old, 3-year-old, 1-year-old children, and they've suffered a stroke. And just imagine at that time in your life, having something that catastrophic occur and needing to receive the kind of assistance that you would need to recover and live a full life, be able to enjoy your life, your kids' lives, and really move forward in a very positive way.
Yeah. This is something everyone should be concerned about. And like you said, Chris, we're seeing younger and younger people who are having strokes. About 10 to 15% of strokes happen between the ages of 18 and 50. So you think all because you're 25 years old, you're not in this category. Well, you certainly are. And we have seen many young people who have fit this category with varying levels of disability. Some light, where you can recover, but we've also seen some strokes that have been absolutely catastrophic to the person. And so we all have to really be mindful of this. And for all of you who are listening, thank you for participating in the Center for Neuro Skills podcast. We want to be here for you, and we look forward to connecting with you on the next Center for Neuro Skills podcast. Thank you so much.